Hari Om friends. So I'm going to talk about two breathing pattern that we normally do in our class. One is abdominal breathing. Before we start the class, we do mindful breath and abdominal breathing. So I'm gonna briefly show you how we do it, and then toward the end, maybe we do Brahmari or humming bee breath, and that is very relaxing pranayama. So let me talk about both and then practice for a minute or two so you can practice on your own as well. So abdominal breathing is like we breathe through our nose. We have two door and two nostrils. We breathe air through the nose, go through the throat, fill up the lungs expand, diaphragm push down, and that's how you see the tummy rising up. And when you exhale, reverse, tummy sink, chest relax, shoulder relax, breathe out, you feel the air. So that's a process of inhalation and exhalation. Now, when we say abdominal breathing or diaphragmatic movement, so diaphragm is one big muscle that separates your chest and abdomen. And when that muscle is stronger, it helps get more air, and it also help empty the lungs as we exhale. As we know that the deep breathing with abdominal breathing practices, it help calm, relax the mind, bring you in the present moment. It reduce the stress, improve the digestions, it improve and support the function of heart, lungs, and liver. It help purify all the toxins from the body. It improve the sleep pattern, and it improve the oxygen absorptions in the body. So let's practice couple round together. In the beginning, if you want to do this way, that help you kind of feel your abdomen and feel your chest, that's also okay. So just come to the present moment and just observe your breath. With the next inhale, feel the air passing through the nose to the chest, to the tummy, and you feel that your hands on the tummy, that tummy filling. And then as you exhale, tummy goes in, chest contract, empty, and exhale through the nostril. Now just observe as you breathe in. No intentional holding, just be aware of it and feel that movement. So these deep breathing practices are very helpful when you are feeling agitated, anxious. These are very relaxing and calming practices. It also help improve digestions and improve the sleep. So before going to the bed, or when you are feeling little anxious or having a long day, just try to practice a couple rounds before that. And when you inhale and exhale, just make sure over the time when you practice exhalation a little bit longer than inhalation, and that is also helpful. Now the second practice we're going to do is the Bhrahmari. Bhrahmari is a humming bee breath, and we're going to do inhale with a nostril, but when we breathe out, we're going to make a makar sound, the ma sound of om, ma makar sound, humming bee breath, and we're going to chant X as we exhale. So there is different way to do it. I can show you all the ways to do it. Like for example, you can do with plugging your ears, without plugging the ears. So I'm going to show you how we do the keep hands. So one hand you can keep resting on your thigh. Other hand you can, or you can just keep both hands on the resting on the hand, on the thigh. And then as you inhale with the nostril, So the makar sound has to be your normal sound. You don't want to alter the makar high pitch or low pitch. Just keep your normal makar sound. It may be different. Some people may have a high pitch, some people have low pitch. What we are trying to do is we are going to try to keep the same vibration of our own voice and feel those vibration in the brain. So we can do by plugging our ear. Make sure your nails are not too sharp. When we inhale, we are not plugging in, keeping it loose. When we exhale, we make it a little tighter and exhale with the makar sound. That's one way to do it. The second way to do it is you can use your thumb, keep your hands over the head, and again inhale with the loose and exhale with the close the seal and exhale with the makar sound. Third way to do it is a Shanmukhi Mudra. 2 fingers gently closing the eyes, ring fingers around your lip, and you're going to inhale with the loose ear, open the ear. You don't want to change the pressure in your ear. So just inhale with your nostril. So here exhalation would be a little bit longer than inhalation, but you don't want to make it too long where you get tired of long breath. You don't want to tire yourself out by exhaling the makar sound. Whatever is comfortable with your own pace, you can do that. So let's do a couple rounds together with me, and try to keep your tongue to the upper palate of your mouth, not to the teeth, because you don't want to feel the vibration in the mouth. You want to feel the vibration up in your head. Normal inhale. Don't plug the ear. Inhale. Inhale, close the ear, exhale. Relax. Observe the sensation and vibration within you. Then slowly open your eyes. So you can practice this on your own. We just did 2 rounds just to show you how to do it properly. There is parasympathetic system activate with the hummingbee breath as well as abdominal breathing, and it brings you relaxation, improve the digestion, and also it releases the nitric oxide in the bloodstream, which help relax the blood vessels. So it's called vasodilation. Long story short, we will not go into the pharmacology of it, but it brings you relaxation, reduce the blood pressure, reduce the stress, anxiety, bring you more calmness, clarity of the mind, improve the sleep patterns. There is so many benefits of it. I'll send you more information in the chat so you can have to follow up. And there is no specific contraindications to it. If you feel like you're running out of the breath, take a break, start again with a slower, smaller round. If you have ear infections, avoid the practice, or unless you have surgery or some brain surgery or ear infection or recent stroke, follow the advice from your doctor, but do the small, like a slow practice. Other than that, abdominal breathing, if you have recent abdominal surgery or hernia, you want to take it easy and don't strain too much, but do it nice and gentle breathing, and always listen to the body. You know your body. Always listen and follow the instinct. Okay. All right. So that's it for now. Drop me if you have any questions in the chat, and I'll see you there in the class next time. Bye.